Welcome to our channel. Today, we're delving into an essential topic for nursing students: understanding heart function. This knowledge is not only crucial for academic success, but also vital for providing optimal patient care. Let's explore some fundamental tips and insights. First, we need to understand the basic anatomy of the heart. The heart is composed of four chambers: two atria on the top and two ventricles on the bottom. Blood flows into the atria, passes into the ventricles, and is then pumped out to the lungs or the rest of the body. Recognizing the flow and the functions of each chamber is pivotal in understanding heart dynamics. Now let's move on to the cardiac cycle. The cardiac cycle consists of two main phases: systole and diastole. During systole, the heart muscles contract, pumping blood out of the ventricles. In diastole, the heart muscles relax, allowing the chambers to fill with blood. Remembering the sequence and timing of these phases is critical for assessing heart health. Pulse measurement and blood pressure values are directly related to these phases. Next is the conduction system. The heart's rhythmic beating is controlled by an electrical conduction system. It begins with the sinoatrial node, often referred to as the heart's natural pacemaker. It sends out impulses that cause the atria to contract, leading to the atrioventricular node's response. Subsequently, the signal moves through the bundle of His, eventually reaching the Purkinje fibers, orchestrating ventricular contraction. Familiarity with this system helps in interpreting ECG results, a key skill in patient assessment. Understanding heart sounds is another significant aspect. Using a stethoscope, nurses listen for specific heart sounds, notably the lub-dub associated with the closing of heart valves. The lub, or first heart sound, S1, is due to the closure of the mitral and tricuspid valves at the beginning of ventricular systole. The dub, or second heart sound, S2, corresponds to the closing of the aortic and pulmonary valves at the start of diastole. Any deviations or additional sounds can indicate abnormalities, underscoring the importance of precise auscultation skills. Heart function assessment goes beyond basic observations. Blood pressure measurement, recognizing normal and abnormal values, is essential. A comprehensive understanding of how factors like age, stress, medication, and lifestyle influence heart function is crucial for evaluating patient health. Let's also consider the relevance of pathophysiology. Common conditions, such as coronary artery disease, heart failure, and arrhythmias, are vital topics in nursing education. Understanding how these affect heart function equips nurses with the ability to anticipate potential complications and intervene appropriately. Finally, let's emphasize the holistic approach to learning about heart function. Integrating knowledge from anatomy, physiology, and pathophysiology into clinical practice not only enhances your theoretical understanding, but sharpens your practical skills. Regularly utilize simulation labs, engage in practical exercises, and seek mentorship from experienced nurses. In conclusion, mastering the intricacies of heart function is indispensable in nursing. By grasping these foundational concepts, nursing students are better positioned to excel academically and provide exceptional care. Remember, the heart is not just an organ, it's the cornerstone of life and health. Thank you for joining us today. Always stay curious and diligent in your studies. Until next time, keep learning and caring.